I am a registered nurse. I work at Peter MacCallum Cancer Centre. I work in radiotherapy nursing. So we look after patients receiving radiotherapy, both curative treatments as well as palliative treatments. And the nurse's role is to monitor patients throughout their treatment and manage any side effects and help patients get through the treatment safely. I first got into research, I guess, because I was very curious. I've always had a curious mind, thinking, well, why do we do things this way, or why don't we do things that way? So naturally, I had been involved in research in my previous career, and it's just such a great area to be doing research because there are so many questions. I'm working on a couple of research projects at the moment. One of them is a project that's looking at that is developing an education tool for patients that are going to have an implanted port. So with that, the project involves the development of the tool, but also looks at the experience of a nurse using patient feedback to develop the tool. So it's really like a co-design type of experience to see how nurses can do that better. The second project that I'm working on, which is really exciting, is called the INTACT study. And the INTACT study is about looking at a couple of different products that are used on radiation therapy skin reactions. Now that study is it's a pilot randomized controlled trial, and it's on patients that are receiving curative treatment for head and neck cancers. I think it's knowing what to do and doing the right thing and knowing why it's the right thing. So for instance, in the INTACT study, there's a lot of anecdotal ideas around what products work better than others, but actually going through a systematic process to understand, well, okay, comparing things in a controlled environment to actually have that proof of one thing working better than the other. So that way you can really improve patient care.